Joining us now, member of the Senate Finance and Intelligence Committees, Democratic Senator Michael Bennet of Colorado. Good to have you on the show this morning.
Thank you.
I wonder how many of your constituents are concerned about their health care coverage?
They're deeply concerned. I was in Jackson County, Colorado not long ago, and of the 25 people there, it's a rural county, Republican county in northern Colorado. Of the 25 people there, only 3 had health insurance. And there was a guy who owned his own business. It was a restaurant with a bowling alley. He and his wife worked 50 hours a week, and he said, there are 2 people. I've got 2 slots I can hire people, but I can't hire anybody. I said, why can't you hire anybody? He said, because they'll lose their welfare. I said, what do you mean by their welfare? He said, their Medicaid. And he's working 50 hours a week. She's working 50 hours a week. They don't have health insurance because they can't afford it, and the people that would work there can't work there because they'd lose their health insurance. So whether you were for the Affordable Care Act, which I was, or whether you were against it, the American people are deeply unhappy with the way our health care system intersects with their families, and we should be fixing it. And instead of fixing it, what we're doing is making matters worse, or Trump is making matters worse. People in college, the insecurity that people feel around health care is higher now than it's been in the 10 years that I've been in the Senate.
So, Senator, the president obviously is trying to completely do away with the Affordable Care Act now. Democrats have that are running for president and in the Senate have a couple of different ways forward. Some are talking about Medicare for all. Would you support that approach?
I don't support that approach. If what you're talking about is the legislation that Bernie Sanders has in the Senate, that would take insurance away from 180 million people who get it through their employer, 80% of whom like it. It would take insurance away from every labor union in America that's negotiated a health care plan, and it would cost $30 trillion. I have a bill with Tim Kaine called Medicare-X that would create a true public option for the American people. It actually starts in rural areas because those are places that have the least competition in insurance, and then over 3 years it migrates everywhere. And I think we've wanted a public option, or I have, since the Affordable Care Act was passed. This gives the American people a choice. It doesn't force them into a plan. It gives them an option, and it creates competition for private insurance, starting in rural areas, as I said. I think that's much closer to where the American people are than wanting to have the government take over the entire health care system.
So you support the Affordable Care Act and reforming the Affordable Care Act, just making some fixes that need to make it more accessible to all Americans, correct? Yeah.
And actually, I don't even think of it anymore as the Affordable Care Act. I think of it as America's health care system. I mean, look, we got to cover everybody. We haven't accomplished that. We spend 18% of our GDP on health care when every industrialized world in the country spends half that on health care. Our families, therefore, spend much more on health care than families in other countries do. We should be working in a bipartisan way to do that as well, and we should make sure that the quality of health care is maintained. All of these things could be done in a working Congress, in a working Washington. None of this stuff can be done in the 3-ring circus that we have here now. It's not possible. I mean, Donald Trump has no idea what he wants to do with health care other than blow up the Affordable Care Act and take health care away from millions of Americans. You will remember, Joe, I know you know this, that this whole plan, the Affordable Care Act, Obamacare, started as Mitt Romney's plan in Massachusetts. He was a Republican. Where are they going to go? You can't go to the right of this plan and create more health care for the American people. They're not going to go to the left of this plan because they've already said this plan is a Bolshevik takeover of the United States of America. It is ridiculous. It is ridiculous.
So, Senator, can you explain to Americans why it is that for some time the United States has spent more money per patient than any country in the world, and yet we do it so inefficiently that working class Americans and middle class Americans don't see the result of that massive investment?
It's because the incentives and disincentives in the system make absolutely no sense at all. It's because we don't invest in primary care so that people are going customarily to their doctors to get a regular checkup so they can discover whether they're healthy or they're sick. It's because we do so much of this work, even after the Affordable Care Act, in the emergency room where it's most expensive. It's because we have no transparency around drug prices. The federal government can't negotiate drug prices on behalf of Medicare patients. It's all of these things. And what does that all add up to? It adds up to not only middle-class families suffering from medical bills that nobody else in the world has to pay, but it also means that we, the United States, can't balance our budget. We can't invest in our infrastructure. We can't do all the things we could do if we were spending 6 percentage points less of our GDP, which Steve Ratner understands very well, on investments in the future instead of on a healthcare system that is completely non-transparent. And, you know, it has been the objective of the drug companies and the insurance companies and others who lobby Washington all the time to keep it as obscure as possible so nobody can actually understand it. That's something we really need to change. And I can't believe that there wouldn't be Republican support as well as Democratic support to make our healthcare system much more transparent and realign the incentives in a way that can make it much more affordable.
So, Senator, you and your entire Democratic caucus are introducing a comprehensive package of reforms. It's called the For the People Act. Tell us about it.
It's a reform agenda to reform Washington, D.C., to put this place back in the hands of the American people. It makes it easier to vote, things like same-day registration. It says we got to overturn Citizens United, which we need to do, and it adds tighter lobbyist reform, which is something I've been involved with since I got here. The bill that I'm particularly interested in that's in this is a bill that would end political gerrymandering in America and say that politicians shouldn't choose their voters. Voters should be able to choose their politicians, and we should get rid of partisan gerrymandering based on work we've done in Colorado, where we've created a bipartisan commission. There are so many things we could do around healthcare, around climate, around infrastructure that are not going to be done until we clean this place up. And I think this bill is the first attempt to try to do it. The House has already passed it, and Mitch McConnell should put it on the floor. By the way, Mitch McConnell, there's another one. He calls this bill a power grab. A bill to restore the government back to the American people, away from lobbyists, away from special interests. That to Mitch McConnell is a power grab, and actually in this case think he means exactly what he's saying, which is it's a power grab by the American people against the special interests and the lobbyists.
Yeah, so Senator, since I've already written an op-ed basically saying you'd be the greatest presidential candidate since George Washington, I'm curious, are you going to possibly run for office and either prove me to be one of the more insightful prognosticators or one of the worst?
One of my worries is that I don't want to make you one of the worst. But and I know that could easily happen because that very nice op-ed was certainly not deserved by me. I'm very inclined to do it, and we're looking at it, and I think, look, the American people need somebody who's going to run and tell them the truth in 2020. We can't get anything done around here if we continue to do what we've been doing here for the last 10 years. It's not just since Trump arrived. You know, Trump is a symptom of our problem, and he's an accelerant of a lot of problems, especially the anti-immigrant tone that he set in this country. But he's not the cause of our problems. The cause of our problems is 40 years of economic immobility for 90% of the American people, stagnant wages over that period of time, periods when we had economic growth, but for most Americans, those were periods of recession. We have to fix that. We have to address that. It's going to take us a generation to do it, and we're going to have to fix our political system at the same time. Like so many other places, you guys were talking about the UK earlier and what's going on with Brexit. You know, in a democracy, you've got to have broad-based prosperity. It doesn't work to have the economic growth accrue to just a handful of people at the very top. It doesn't work. So what a great project for the United States to come together and say, we're going to address that here, and we're going to preserve this republic for another 200 years.
And Senator, really quickly, just to clarify, there have been pundits that have been saying you're waiting to see whether Joe Biden gets in the race or not. Your decision, I understand, has absolutely nothing to do with whether Joe Biden gets in the race or not. Is that true?
It has absolutely nothing to do with the vice president's decision.
All right. Well, very good.
Right.
We'll leave it there.
Thanks for having me.
To do it.
See you soon.
Don't prove me wrong, Senator. Don't prove me wrong. All right. Thanks so much for being with us. Greatly appreciate it.
Nice to see
Casey
you.
Hunt. For some time, I've been hearing about Michael Bennet. That's actually, I've never met the guy. A lot of people thought that we must have been college roommates after they read my op-ed about him.
Can't imagine why.
But I have heard more of him than just about anybody else over the past decade, that he's one of the more thoughtful, one of the more articulate, one of the more capable senators in Washington, D.C. What's been your impression of him, and what type of presidential candidate would he make?
Joe, I have actually known Senator Bennet in my years covering the Capitol for quite some time, and he is somebody who is very thoughtful about the issues. He's steeped particularly in questions about education because of his background in Colorado. He knows how to win in a purple state because, frankly, when he was first running for office, Colorado was less blue at the time than it has sort of become. He's typically a pretty mild-mannered, even-keeled guy, whose family is, tied in with a lot of our sort of institutions and establishment as well. It's a family that certainly has been part of our public life. But, I think one of the things that's made him stand out, and part of why we have taken such notice, that speech he gave on the Senate floor, very impassioned. I mean, his comments on health care, he seemed, angry in a way that I think people could potentially relate to. And the fact that he's showing that kind of emotion, I think, really stood out to those of us who've watched him for many years, because it really does, tell you something about how he really feels, considering he normally isn't like that.